The good news is that between 30 and 50% of most common cancers might be preventable through diet and lifestyle changes.
Cancer is one of the most deadly diseases worldwide, but what if daily diet could play a role in its development, or maybe in its prevention as well? Some research studies have discovered that diet can be a key factor in developing and preventing cancer. In this video, we will explore the expertise of Dr. Michael Greger, a well-known advocate for plant-based diet and disease prevention. With the help of Dr. Michael, we will disclose the 3 worst types of foods that can give life to cancer cells. But that's not all. We will also be sharing what you should be eating to reduce your cancer risk in the long run. Before diving deeper into the video, let's first discuss what environment cancer requires to thrive and progress into tumors. Cancer grows and progresses in an environment with chronic inflammation, oxidative stress, and an imbalance in cellular growth signals. The cancer cells develop into tumors when the tissues are in constant inflammation, leading to DNA damage and disturbance in normal cell function. This damage is further worsened by the oxidative stress resulting from the free radicals. In addition to that, cancer also loves a nutrient-rich environment where glucose is in high amounts, which helps cancer cells grow rapidly, turning into cancerous tumors. However, there are other factors as well that are connected to the foods we eat daily. So let's discuss those 3 foods that feed cancer cells: red meats like beef, lamb, and pork, and processed meat like sausages, hot dogs, bacon, and deli meats are shown to have a strong link with the increased risk of cancer development, especially colorectal cancer. The World Health Organization's International Agency for Research on Cancer, IARC, has named processed meat as carcinogenic to humans and red meat as possibly carcinogenic to humans. This means that both types of meat may trigger the risk of cancer. The reason for these meats being carcinogenic is because they contain nitrates and nitrites, the substances that are added to processed meats as preservatives. Later on, these compounds convert into N-nitroso compounds, NOCs, which are carcinogens. This process occurs when the pH is low in the stomach, in the presence of iron, or when the meat is cooked at high temperatures. In addition to that, when fresh or processed meat is cooked through barbecue, grilling, and frying, it releases compounds like heterocyclic amines, HCAs, and polycyclic aromatic hydrocarbons, PAHs. As a result, these compounds damage DNA and encourage cancer development. Heme-iron, on the other hand, is another lurking threat found in red meat. This type of iron helps give rise to NOCs in the gut, resulting in colorectal cancer development. Additionally, it may also trigger oxidative stress and inflammation, ultimately increasing the risk of cancer. Many research studies have discovered a strong link between red meat and the risk of cancer. A meta-analysis published in Cancer Science showed that red or processed meats can elevate the risk of colorectal, colon, and rectal cancers. Another research study discussed in the Journal of the American Medical Association, JAMA, demonstrated that a high intake of red and processed meat can increase overall mortality from both cancer and cardiovascular disease. Furthermore, a significant research study was carried out in the European Prospective Investigation into Cancer and Nutrition, EPIC, which involved the population of 10 European countries, showed that red meat consumption can greatly increase the risk of colorectal cancer. The study proved that the individuals who had consumed large amounts of unprocessed or processed red meat had an increased likelihood of cancer development than individuals who didn't. Aside from colorectal cancer, there is some research evidence that red meat can also increase the chances of other cancers like liver and lung cancers. A research study published in PLOS Medicine showed that individuals who had consumed large quantities of processed red meat had a 20% increased risk of colorectal cancer and 16% increased chances of lung cancer compared to individuals who consumed the least amount.
But even after ignoring major parts of the available evidence, they still found an association between meat intake and an increased risk of cancer. And not just cancer, they found that adherence to dietary patterns lower in red or processed meat intake may result in a decreased risk for premature death, cardiometabolic disease, and mortality, meaning the risk of getting and dying of diseases like heart disease and type 2 diabetes, as well as the risk of getting cancer and dying from cancer. Yet they still concluded in their dietary guideline recommendations, continue your current red meat consumption, continue your processed meat consumption.
Dr. Michael Greger discussed a research study in which experts continued to claim that it is safe to consume unprocessed and processed red meat without realizing its dangers. However, following another randomized trial, it was concluded that there was a connection between red meat consumption and increased risk of cancer. Similarly, lower or no consumption of red meat was linked with lower risks of premature deaths, cardiometabolic diseases like heart disease and type 2 diabetes, and both cancer risk and mortality.
Colorectal cancer is our second leading cause of cancer death for men and women combined after lung cancer. So if you don't smoke, colon and rectal cancer may be your greatest cancer nemesis, but we can drop the risk of getting it by about a fifth with a single dietary tweak, cutting a serving of processed meat out of our daily diet.
Additionally, he says that colorectal cancer is the second major cause of death after lung cancer in both men and women. Therefore, if someone doesn't smoke, colorectal cancer can be their biggest cancer nemesis. However, its risk can be eliminated by cutting out a serving of processed meat from our daily diets.
I believe that for the majority of individuals, the desirable effects like lowering your risk of family-devastating cancer and heart attacks associated with reducing meat consumption probably do not outweigh the undesirable effects like having to give up all that yummy meat. This is what led them to make their recommendation to continue current consumption.
According to his video, it's not only colorectal cancer that may be the threat. Processed meat can also increase the likelihood of prostate, breast, and pancreatic cancer. Despite the growing risk of cancer associated with meat consumption, there aren't any measures taken in the US. Lastly, Dr. Michael Greger said even those who are diagnosed with cancer don't attempt to change their diet and lifestyle. It is majorly due to their doctor not advising them to improve their diet during or after treatment. Therefore, to minimize the cancer risk, it is highly recommended by both Dr. Michael Greger and health experts that red meat, both processed and unprocessed, should be consumed in a limited manner or cut out completely. Instead, one should opt for healthier and natural options like plant-based diets and whole and unprocessed foods. But before we continue, this content is provided for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult a qualified healthcare provider with any questions about your health or a medical condition. Alcohol is the second most harmful food or beverage that helps cancer cells grow rapidly. This killer beverage has been shown to have a connection with several types of cancer like the esophagus, liver, mouth, rectum, breast, throat, and colon. The more someone consumes alcohol, the more chances they have to develop these cancers. Moreover, it's not about the quantities anymore, because even if you consume it in small amounts, you will still have the risk of developing cancer. Once inside the body, alcohol converts into a chemical called acetaldehyde. This chemical readily damages the DNA and creates an environment favorable for cancer. Furthermore, alcohol can also trigger hormonal imbalance by increasing the amounts of hormones like estrogen, which can encourage the development of hormone-related cancers like breast cancer. On top of that, it may also disable the body from absorbing nutrients, further increasing the risk of cancer. Many research studies have shown the connection between alcohol consumption and increased cancer risk. A research analysis discussed in the Journal of Oncology demonstrated that even a single glass of alcohol per day can increase the likelihood of mouth, throat, and esophagus cancer. Another research study published in the Journal of Cancer Epidemiology, Biomarkers and Prevention proved that heavy alcohol drinkers carried elevated risk of liver and colorectal cancers. According to the American Cancer Society, alcohol is responsible for 6% of all cancers and 4% of cancer deaths in the United States.
So we used to think that moderate drinking was beneficial in terms of reducing our risk of heart disease. Now, we've always known that alcohol is a carcinogen. I mean, that's undisputed. Right? Alcohol causes cancer because alcohol is metabolized into something called acetaldehyde, which is a known human carcinogen. Increases the risk of over a dozen different cancers. So including like breast cancer, even very light drinking, like less than a drink a day, increases your risk of breast cancer because it's a carcinogen.
Dr. Michael Greger says that people used to think that moderate drinking meant a lower risk of heart disease. However, alcohol is a carcinogen, which is metabolized into acetaldehyde, a human carcinogen responsible for the onset of different types of cancers, including breast cancer. He confirmed that even the lightest drinking, like 1 glass per day, can increase the risk of breast cancer because of its carcinogenic effects. He further said that studies suggested that people who drank moderately had lived longer than people who didn't drink at all. This was the idea of the J-curve, in which light drinkers were seen living longer than those who didn't. However, it turned out to be false due to the sick quitter effect. People who were non-drinkers used to be heavy drinkers in the past, but had to quit due to health issues.
That there was a systemic, this was an artifact, this J-curve, was an artifact of the systemic misclassification of former drinkers as if they were lifelong abstainers. In other words, this is what's called the sick quitter effect. So when they ask people how much you drink, they say, I don't drink at all. They think, oh, well, you're a teetotaler, right? Right? Okay, but did they just stop last Tuesday because they got liver cirrhosis, right? That the reason they're not drinking is because drinking made them sick.
Since this J-curve has now vanished, it is clear that a higher amount of consumed alcohol leads to an increased risk of death. This confirms that even moderate drinking is not encouraged because of its dangers to overall health and cancer risk. Before we continue, if you're eager to explore how your diet can reduce your cancer risk and enhance your overall health, don't miss out on the QuickTime newsletter. Sign up using the link below and get weekly updates packed with expert tips, mouth-watering recipes, and practical advice to help you live longer and feel amazing, all delivered straight to your inbox. The last type of food on our list is a group of dairy products. Who knew that dairy products could pose a major cancer risk despite being an everyday choice for most households? According to research, dairy products can trigger the development of several types of cancer, including prostate, breast, liver, and colorectal cancers. It occurs through a variety of mechanisms. Dairy products are packed with hormones such as insulin-like growth factor, IGF, which can help encourage the growth of cancer. This hormone is especially connected with the prostate cancer risk. Secondly, whole milk and other fat products can lead to obesity, which in turn increases the risk of several types of cancer. As a result, excessive body fat often leads to chronic inflammation, forming a favorable environment for cancer. Consuming high amounts of dairy may elevate the likelihood of ovarian cancer. This is because of the high lactose content in milk, which turns into galactose in the body. Galactose is a sugar that can damage the cells in the ovary and may lead to cancer development. Calcium and vitamin D, on the other hand, can also increase the risk of cancer. While both of these are vital for bone health, their excessive quantities in the body can elevate the likelihood of prostate cancer. A research study published in BMC Medicine showed that individuals who consume dairy products daily can develop liver cancer and female breast cancer. Another meta-analysis published in the Journal of Nutrition showed the link between the consumption of whole-fat milk and increased risk of prostate cancer.
They found that the more calcium people consume, the higher their risk of prostate cancer. Yeah, but most people get their calcium from dairy, so how do we know this isn't just a dairy effect? Before we start worrying about kale and other non-dairy sources of calcium, it'd be nice to see dairy calcium teased out from non-dairy calcium intakes, and that's exactly what they did. Yes, the more calcium from dairy sources, the higher the risk of cancer, but non-dairy sources of calcium were found to be protective. So it wasn't a calcium effect, it was a dairy effect.
Dr. Michael Greger said in one of his videos that every dairy product, even the fat milk, is associated with the risk of prostate cancer. He further said that at first it was concluded that a high amount of calcium consumption leads to prostate cancer. However, it wasn't calcium all along. After some research, it was discovered that it was a dairy effect that led to cancer development. Dr. Michael said it might be the animal protein that boosts the levels of IGF, an insulin-like growth factor, a hormone that promotes cancer.
They suggest it's the animal protein boosting the levels of a cancer-promoting growth hormone called IGF-1, insulin-like growth factor 1.
Therefore, it is highly recommended to cut out or limit all 3 of these foods or beverages to reduce your cancer risk. Instead, you should opt for the diet suggested by Dr. Michael Greger.
Authority on diet and cancer is that those with cancer should follow the same diet that helps prevent cancer from taking root in the first place. That means more whole grains, vegetables, fruits, and beans, while limiting fast food, processed food, meat, soda, and alcohol. Similar recommendations have been put forth by other cancer authorities: more fruit, vegetables, whole grains, and beans, and less salt, sugar, meat, and alcohol.
That is it. If you liked watching this video, give it a thumbs up and subscribe to our channel. If you wish to know more about the anti-cancer diet, watch this next video.